You've been forgetting names, losing your keys, and you're terrified it's Alzheimer's. Stop. In the next few minutes, we are going to prove that what you think is permanent decline might actually be a temporary side effect of a pill you took this morning. If you've been feeling confused, don't just accept the diagnosis of getting old yet. In this video, we are going to uncover the specific medications that mimic dementia symptoms and show you how to spot the difference. We call this pseudodementia. It is reversible. We will break down the anticholinergic burden concept. We will reveal the 3 common over-the-counter drugs that cloud your memory. Finally, we will give you the exact questions to ask your doctor to get your mental clarity back. Let's get wiser. When we talk about thinking and memory, we are talking about chemical messengers in your brain. The most critical messenger for forming new memories and staying sharp is called acetylcholine. Think of acetylcholine as the brain's immediate email system. It sends vital messages quickly across different brain regions. Now imagine taking a medication that is designed to block those email messages. That is what an anticholinergic drug does. These drugs were created to help with things like muscle spasms, runny noses, or overactive bladders. But they do not discriminate. While they are blocking the signals in your bladder, they are also blocking the memory signals in your brain. For a younger person, the body processes and eliminates these drugs quickly. The memory effects are temporary. But after 60, our metabolism changes drastically. Our liver and kidneys do not clear drugs nearly as fast. That anticholinergic pill lingers much longer. It accumulates day after day. This accumulation creates what we call the anticholinergic burden. It slows your mental function down. It looks exactly like early-stage dementia. This is a serious issue. Studies have linked high anticholinergic burden to significantly increased risks of cognitive decline, even permanently if not addressed. You deserve to know what is causing the fog. If you want more evidence-based wisdom like this, be sure to subscribe to Primetime Wisdom. We cut through the noise to bring you the insights that matter most. Let us look at the first massive culprit. These are the easily accessible over-the-counter drugs. Most people don't even think of them as serious medication. We are talking about certain allergy and cold medicines. If you routinely take a common antihistamine that promises to make you drowsy or helps you sleep through the night, check the label. If the active ingredient is diphenhydramine, you are taking a powerful anticholinergic. Diphenhydramine is often marketed for sleep, but it works by heavily blocking those vital acetylcholine memory signals. Taking this drug every night is like purposefully putting sand in the gears of your memory center. Many seniors take this drug nightly for years, believing they are helping their sleep. Instead, they are sabotaging their memory function. Your clear takeaway here is this. If you rely on a nighttime cold or allergy medication, look for an alternative that uses a different active ingredient. Discuss non-drowsy options with your pharmacist. Do not sacrifice your memory for a clear nose. The second major category involves sleep aids and anxiety medications. This includes a class of drugs known as benzodiazepines, such as lorazepam or diazepam. These drugs are often prescribed to reduce anxiety or help with insomnia. While they are effective in the short term, they have a heavy cognitive toll, especially in older adults. These drugs are often referred to as, quote, sedative hypnotics. They slow down brain activity, This is intended to calm you down. But this generalized slowing affects everything, including your processing speed and coordination. Think of trying to solve a complex problem when your brain is operating at half speed. That slowdown is why these drugs are also strongly linked to increased fall risk. The worst part is the lingering effect. Even if you take the pill at 9 p.m., the medication might still be active in your system the next morning and into the afternoon. If you feel groggy, slow, or confused when you wake up, that is not a restful night's sleep. That is a drug hangover. If you take this medication daily, the hangover never leaves. That chronic confusion is easily mistaken for natural aging. The solution is not to quit these drugs immediately. Sudden withdrawal can be dangerous. The solution is awareness. If you take this class of drugs, you need to collaborate with your doctor to explore alternative, non-sedative strategies for anxiety or sleep. Cognitive behavioral therapy for insomnia, or CBTI, is proven to be a safer, more sustainable alternative. Focus on non-pharmacological methods first. The third hidden culprit often confuses people the most: bladder control medications. As we age, managing an overactive bladder becomes common. Doctors frequently prescribe drugs specifically designed to relax the bladder muscle. They are highly effective at their job. The problem? They are potent anticholinergic agents. They work by blocking acetylcholine signals in the bladder muscle. But again, this chemical blocking travels throughout the body. If you started taking a bladder control medication 6 months ago and suddenly found yourself struggling to recall names, the connection is clear. Your bladder may be performing better, but your memory center is suffering a serious block. This is a cruel trade-off that many seniors are forced into unknowingly. This category often has safer alternatives that use different mechanisms. You must discuss the specific anticholinergic load of your bladder medication with your doctor. Do not assume there is only one way to solve the problem. There are physical therapies and other drug classes that might reduce your overall burden. Now that we know the 3 main types of cognitive thieves, we need a way to measure the risk. This is where the anticholinergic burden concept becomes your wisdom tool. Imagine a score from 0 to 3 for every drug you take. 0 is safe, 3 is extremely risky. If your total score exceeds 3, evidence suggests your risk for cognitive impairment and dementia symptoms rises sharply. You do not need to memorize a complex medical list. You just need to perform a simple inventory. Grab a small bag, we call this the brown bag review, and put every single medication, vitamin, and supplement you take inside. Include the over-the-counter drugs too. Now look closely at the drug label or the pharmacy paperwork. Are you taking any of the 3 major categories we discussed? If you are taking 2 or 3 high-risk medications, your total anticholinergic burden is almost certainly too high. This is the moment to pause. Do not panic. Do not change anything yet. You now possess the knowledge that empowers you to have a constructive, evidence-based conversation with your doctor. But the confusion can also come from less obvious places. It is not always about acetylcholine. Sometimes memory issues are caused by drugs that simply slow down your brain function through sedation or by disrupting your mood. Consider certain antidepressants. While depression itself can cause concentration problems that mimic dementia, some older antidepressants, particularly those known as tricyclics, have strong anticholinergic effects themselves. They were very effective, but carry a significant burden. If you are on an older medication for mood, ask your physician if a newer class of drug might be less likely to cause cognitive side effects. The goal here is optimization. Another category we must address are specific pain relief medications. Many seniors rely on muscle relaxers for chronic back pain or spasms. Drugs like cyclobenzaprine, for instance, are widely prescribed, but they are powerful sedatives. They cause significant drowsiness, dizziness, and confusion, especially in older adults whose kidneys struggle to clear the drug efficiently. If your pain medication makes you feel like you are walking through mud mentally, it is impacting your cognition. There are non-pharmacological routes to pain relief, including physical therapy, heat, and non-opioid, non-sedating medications. Always explore the least cognitively impactful choice first. Your mental clarity is too valuable to trade for muscle relaxation. What about those subtle, non-specific symptoms? Memory loss is terrifying, but pseudodementia can show up as simple confusion, dizziness, persistent dry mouth, or chronic constipation. Dry mouth is a common anticholinergic side effect. If you constantly feel the need to sip water or use lozenges, ask yourself, is this just aging, or is this the dry mouth caused by my medication? Chronic constipation is another widespread complaint. Many anticholinergic drugs slow down your entire digestive tract. These subtle physical changes are often the early warning signs that your medication load is too high and is beginning to impact your nervous system. Do not ignore these small symptoms. They're the signals that your body is being challenged by your current prescriptions. Listen to these signals. They are providing the wisdom you need to make adjustments. We have identified the problem. Now, how do we fix it? The key concept here is deprescribing. Deprescribing is the process of safely and methodically reducing or stopping medications that may no longer be beneficial or are causing harm. This is not about immediately throwing pills away. That can be dangerous. This is a scientific, collaborative process with your medical team. Your first step is preparation. You need data. Use the brown bag review we discussed. Write down every single pill and why you think you are taking it. Then, identify which medications fall into the high-risk anticholinergic categories. Your next step is the conversation. This is the most crucial part. Doctors are busy. They often inherit a complex medication list from previous doctors. They rely on you to raise concerns. You need to approach this as a partnership. Here are the exact phrases to use when talking to your physician. Do not say, "I want to stop taking this pill." Say, "Doctor, I am concerned about my recent memory loss. I have identified that my anticholinergic burden may be high. Could we review my current prescriptions to see if there is an equally effective non-anticholinergic alternative we could try?" Frame it as a desire for a trial reduction or a therapeutic substitution. Ask, if we temporarily reduce the dosage of this specific sleep aid, could we see if my daytime confusion improves? Most doctors welcome an informed patient. They recognize the risk of polypharmacy, taking many pills in seniors. Showing them you have done your homework proves you are serious about improving your quality of life. not just ignoring medical advice. Why is this process of deprescribing so challenging for older adults? It comes down to our metabolism and the concept of tolerance. After years of taking a drug, your body adapts. If you stop too quickly, you can experience severe withdrawal symptoms, rebound effects, and instability. For instance, stopping anxiety or sleep medications abruptly can cause extreme anxiety, insomnia, or even seizures. This is why supervision is mandatory. Your doctor can help you taper off the drug very slowly, sometimes over several weeks or months. Slow tapering allows your brain and body to gradually adjust and restore normal function without a catastrophic crash. Furthermore, we must address the fear of recurrence. You might worry that if you stop the bladder medication, the problem will instantly return. This is where the wisdom comes in. You are exploring other solutions simultaneously, like diet changes, hydration management, or physical exercise tailored to the specific condition. Deprescribing is not about suffering. It is about replacing one crutch with a healthier, non-chemical support system. There is another insidious fear that keeps many seniors on unnecessary medications: the fear of disappointing their doctor. Remember, your doctor's primary goal is your well-being and function. If a medication is harming your memory, it is undermining your overall quality of life. An open, honest discussion about balancing symptom control with cognitive integrity is always appropriate. Let us briefly recap the steps you can take starting today to move from confusion to clarity. First, inventory everything in your medicine cabinet, focusing on the three main culprits: sedating antihistamines, benzodiazepines for sleep/anxiety, and anticholinergic bladder control drugs. Second, schedule a dedicated appointment with your primary care physician specifically for a medication review. Third, use the informed language of trial reduction and anticholinergic burden to guide the conversation. We need to empower ourselves to live sharper, wiser lives. Do not let complexity deter you. Start small. Focus on replacing one high-risk medication with a low-risk alternative. Once you regain mental clarity, the improvement often inspires you to make further positive changes. This knowledge gives you power. It transforms the terrifying prospect of permanent decline into the hopeful reality of a solvable, reversible problem. You are not destined for confusion. Your mind can be sharp and functional long into your later years. Sometimes, getting wiser means subtracting, not adding. If this video has clarified the path forward for you, please like the video. It helps other informed, wise adults find this critical information. And subscribe to Primetime Wisdom. We are dedicated to providing the practical advice you need to build the well-lived life you deserve. Use this wisdom. Take action today. Stay sharp and stay wise.